So nowadays we have, lot of patients with respiratory illness in children, and especially they are getting admitted in the hospital in HDU or in pediatric ICU. So these are the important points need to know. Main causes are viral, mostly they are RSV, influenza. Also there is a COVID variants, difficult to diagnose. Airway suction is the priority, and you can attach oxygen if baby having a distress or not maintaining saturation, especially like you need to keep oxygen saturation more than 94. If the patient is quite sick, early x-ray is very important, especially looking for pneumonia and the complication. Nebulizers, a lot of times we are giving them nebulizers with salbutamol or anticholinergics like ipratropium bromide, and they are helpful mostly. Antibiotics mostly they don't need, but if you think that you have to give them first line antibiotic, then augmentin or Zanesif is fine, or ceftriaxone. No need to change like quickly antibiotics, especially going to the second or third line antibiotics. Mostly we know they are viral and they will improve with time. Normally they are taking like 5 to 7 days. Some patients they may need steroid, especially if they are too much wheezing and there is no pneumonia on the x-ray. The single most important thing in these patients is monitoring vitals and also monitoring of the intake output record, because a lot of times you admit them in the hospital and they are you give them IV fluid and they are overloaded. So you have to keep on the negative balance, but obviously you cannot keep negative balance unless you have a better IO charting. Physio and suction is very helpful, and a lot of these patients they have reflux, so you have to give them anti-reflux medication. Really we try to encourage NG feeding early, especially if they are tachypneic or even they are ventilated. Discourage formula feeding, and if the mother is giving breastfeeding and baby is tachypneic but still can suck and take breastfeeding as long as under observation. You have to rule out cardiac problem, especially on exam, any signs of myocarditis or any left to right shunts like persistent ductus arteriosus or any VSD, because then they may need restriction of oxygen. Means if you give them more oxygen, their lungs are over flooded. So you have to manipulate the pulmonary vascular resistance. Ventilation if needed, preferably you have to put them on non-invasive like high flow nasal cannula, because invasive there are air leaks very common. If you put them on ventilator for some reason, then obviously pressure control is better with the better peak inspiratory pressure to get better tidal volume and minimal rate according to the age. Give them less IE time if they are not much hypoxic, and they give them more expiratory time so that they can empty well. You can repeat chest x-ray, obviously if the patient is sick and worsening condition, or you think any kind of complication. Especially blood cultures and antibiotics are very important in babies who are very sick to begin with, small babies, and they have raised inflammatory marker like WBC high count or CRP is on the higher side. Also again in these patients, early x-ray is important, especially if they are sick or small one, because they may have big atelectatic lung, segmental collapse, or pneumothorax. Thank you very much.